Hi, my name is Samantha Illangasekare, and I'm an assistant scientist here in the Department of Population, Family, and Reproductive Health. And I'm going to talk to you today about a project called the Asset Mapping Project, which faculty from our department here, as well as across the school, are involved in. And the Asset Mapping Project is work that's being done by a unique partnership called the Community Health Initiative, or the CHI. And the CHI was started to bring together East Baltimore residents, community groups, city officials, as well as Johns Hopkins, so that we could collaboratively address the health of our community using a community-based participatory research approach. And our overall mission was really to engage in an intense process of planning and critical thinking about how to develop and implement community health interventions. So what our group decided to do was take an assets-based approach to our work. And we did this because we thought about what's typically been done in public health initiatives, and we knew that usually when trying to improve the health of a community, we often focus on problems or the deficits that exist, and then we try to think about how to fix them through either programs or policies or interventions. But by only identifying needs and problems, this approach can really focus on what is wrong with a community and what's wrong with a population. And it tends to ignore the unique strengths and assets that we know exist in all communities. So what we wanted to do was take an approach that would instead help us identify the assets in our own community instead of only focusing on the deficits. And so by determining what the strengths and assets are that already exist in East Baltimore, we could then mobilize them and leverage them so that we could address the most pressing health concerns that our community members face. And so through many months of intense discussion and also a lot of work put in by community members as well as Hopkins faculty, staff, and students, we were able to develop a research plan, and we were able to then also create an interview guide to use to engage East Baltimore community members in conversations to talk about what assets they see in their own neighborhoods. And what we were interested in was learning about assets that ranged from the physical structures or resources in a community all the way to the human assets, so things such as skills and expertise of community members. And so to do this, we hired and trained community residents so that they could actually conduct these interviews. And we were then able to work in teams comprised of both community members and university partners so that we could analyze the interview data after it had been collected and transcribed. And ultimately, our trained interviewers were able to talk to 160 English-speaking residents, as well as 20 Spanish-speaking residents from the 5 zip codes that surround the East Baltimore Hopkins campus. And from these interviews, we learned about thousands of different assets in East Baltimore. So for example, we learned about churches and other faith-based institutions that are not only serving the community for religious purposes, but are also providing back-to-school drives and opening food pantries to serve their community members. We also heard about a business owner who provides free meals during Thanksgiving to over 500 community residents and gives out Christmas baskets to families in her community. And we heard about how community organizations are partnering with the schools in East Baltimore to run after-school education programs. And so now, knowing all of these assets and understanding the types of assets that exist, we can move forward to think about how to connect and harness these existing resources and strengths so that by doing that, we can create even more opportunities to improve the health of the community in a collaborative way. So thank you so much for your interest, and we hope to be able to share more about our work in the Community Health Initiative with you in the future.